Good morning, everyone. Can you hear me okay? Wonderful. My name is Kerry Zoss, and I'm the Nurse Residency Program Coordinator, and I want to welcome you to part 2 of our webinar series regarding interview preparation for the Stanford Health Care Nurse Residency Program. I am joined by several individuals today. One of them you all know very well, Kevin Silvestre, my colleague in Human Resources. He is the Senior Consultant for Talent Acquisition and works really closely with all of our nurse residents on recruitment for our nurse residency programs. So Kevin and I are going to facilitate today's webinar. Kevin will manage the chat, and we have dedicated time during this session for Q&A. So any questions you have, feel free to put them in the chat as we move forward with the presentation. I also am joined today by 5 individuals, 4 of whom are current nurse residents within our nurse residency program. They are in cohort 32. Edward Cow is a clinical nurse 2 in oncology. Nathan Torres, clinical nurse 2 in BMT. Bianca Flores, clinical nurse 2 in neurology. And Mia, who is a clinical nurse 2 in surgical oncology. And then in addition, I'm joined by Letty Cortez, who's a clinical nurse 4. She is an educator at Stanford Health Care and a preceptor. And so she will be able to provide some insight as she sits through the unit-based interviews for nurse residents and also precepts nurse residents. So any questions about what are the department or unit-based interviews like, I will defer to her. And then regarding kind of working with preceptors, I will also defer those questions to her. So a great panel today. The goal of today is kind of 3 parts. So we want to be very transparent about our interview process, whether you are participating in our interviews, which will start on May 10th, or you're kind of just looking around and want some insight. We're going to share with you our structure and our process. Very quick slide on our program application qualifications, because that's a question that we always get. So I'll have that available to all of you. And then some information about what is the residency program? What does that look like? We get a lot of questions just kind of about the nuts and bolts of the residency program. And then really some dedicated time for you to ask our nurse residents, myself, Kevin, and Letty, kind of all of those burning questions that you have. So for those of you who are participating in the interviews for our summer cohort, which is cohort 35, Human Resources has contacted and is currently contacting prospective candidates. All of our interviews, our panel interviews, will take place over 2 days, so May 10th and 11th. And you can see on the screen, we are interviewing into critical care, oncology, surgery, medicine, and then the clinical decision unit in the emergency department. So all of those specialties have their own panels. We have a high number of residents being hired into medicine and surgery. So we actually break those panels into a division 1, which is focused on certain units, and then division 2, which will focus on a second set of units, just because the managers hire more. So we bring in more candidates into that pool. The way the panel structure works is they currently are all via Zoom and will be virtual for our summer program. And there are 5 panels per day with 4 nurse residents on each panel. So we're looking at 20 nurse residents per that specialty per day. The hiring managers for those specialties will be on the call, as well as a facilitator. And those hiring managers will introduce themselves and their departments. And then the facilitator will be the one who runs the entire interview. They will be the ones who provide opening instructions and welcome. They will be asking all of the questions, and then they will close the interview and provide you with next steps. And then all of the questions, and we'll go into this in a little bit more detail throughout this presentation, are behavioral style interview questions. We only ask 4 behavioral style interview questions. So if you are interviewing, know that you'll be asked to introduce yourself, and then you will answer 4 behavioral style interview questions, and then that's it. The same 4 questions are asked to all the candidates. The order in which they are asked rotates amongst the candidates. So not trying to trick you. No one gets a harder question. You all get the same questions, but we rotate the questions. So the same person doesn't always hear the first question multiple times. So this is what the structure would look like. It's two parts. There is a panel interview, and then there's a unit level interview. So with a panel interview, you will come on screen and you will be given the opportunity to introduce yourself. We do ask some very specific components. We ask that you introduce your name, your degree, where you went to school. If you had a senior preceptorship, we know COVID has impacted that, but if you did have a senior preceptorship, we ask where it was and what was the specialty. Any work experience, it could be healthcare, it could be non-healthcare, we ask you to share that with us. And then the managers kind of get to choose this last tidbit. Perhaps, why did you choose Stanford? Why did you choose the specialty that you put on your application? I would like to, interview for critical care, or I'd like to interview for oncology. Why did you choose that? Or perhaps, why did you choose nursing as your profession? Just to get a little bit more insight on you. Then we'll switch to the behavioral style interview questions, and then there will be a conclusion. The facilitator will wrap up the interview. They will provide you with next steps. At this part of the panel interview, there's not an opportunity for candidates to ask questions. And the reason is because the hiring managers are all hiring into different specialties. They're all hiring different shift rotations. So we want to keep it very clean and give you the opportunity to ask those specific questions at the unit level interview. So you get all of that information and there isn't a lot of confusion. During the conclusion part, you will be told when the follow-up unit level interviews will be. The unit level interviews for our summer cohort will take place on May 13th. No, let me say that right, 10th, 11th. They will take place on the 12th, the 13th, and the 14th. So panel interviews are Monday, Tuesday. Unit level interviews will happen on that Wednesday, Thursday, Friday. People always ask, what does that unit level interview look like? I'll let Letty speak a little bit more later on the presentation. She has a bit more insight, but essentially this is your opportunity really to meet with that unit leadership team. It may just be the managers, or the manager may invite the educator and the clinical nurse specialist, as well as staff. We recommend all of our interviews be a virtual platform, whether that be via Zoom or it's a phone interview. Some managers may ask you to come in person and meet you outside, mask and social distancing. It really is kind of dependent on manager preference, but this is your opportunity to ask all those questions. So what is the shift? Can you tell me more about the patient population? Tell me about your team dynamics. What are your unit challenges? What are your opportunities for growth? So all of those burning questions that you have, you want to bring them to that unit level interview, and that's the opportunity to ask them. So for those of you who applied, the one thing you may have seen is the application was very much on who you are as an individual. So a lot of questions about a time you made a mistake, or a time you provided compassionate care, or what your goals are. What did you have to overcome to get to those goals, to get to that outcome? So it really asks you about who you are as an individual. So we can really look at you and say, does this individual represent the Stanford nurse that we are looking for? Do their values align with the values of Stanford Health Care? And then once we see that, we bring you forward and then we present you to the hiring managers and we say, here are the individuals whose values really align with Stanford nursing. And now is the opportunity to see how will they perform in the clinical setting? How can they demonstrate their clinical knowledge at that advanced beginner level? So we get who you are, and then we want to know, what are you going to do? So two kind of different strategies on how we recruit. We want to look at behaviors, and then we're going to look at how you perform. The one thing I want you to remember is that you are all advanced beginners in your skill set and in your experience. Even when you come into the nurse residency program, you come in as advanced beginners. And our goal in like a year is to get you to that competent individual. It takes a while. Competency is a learned skill, not an immediate skill. And so the hiring managers are aware of that. So know that they're aware of your scope as a student nurse. They're aware that you can and cannot do things in your rotations. They're aware that your rotations were impacted by COVID. Some of it was virtual, some of it was simulation. That is okay. Don't feel like if your story or your answer is not this amazing moment where you saved lives, that's not what they're looking for. They're really looking that you listen to the question, you took some thought, and you're able to articulate, this is how I worked through this situation. And that's what they're looking for at that advanced beginner level. So behavioral interviewing, it's how we structure all of our interviews at Stanford. And what is it and why do we do it? So behavioral interviewing is going to focus on your past experiences, because we're going to ask you to provide specific examples of how you have demonstrated certain behaviors, knowledge, skills, and abilities. And a lot of those specific examples we will ask, the question will be asked, tell us about a time during your clinical rotation, because we want to know how you demonstrated a certain behavior while you were in the role as a registered nurse or a clinical nurse or a nursing student. So the role of a nurse. When you answer the question, it gives us an idea of how you performed given a certain circumstance, and it allows us to kind of predict how you would behave given that same circumstance going forward. The questions tend to be very specific and very probing, so not a lot of gray area. A lot of that is, tell us about a time when you did this, what was the action you took, and what was the outcome. So very, very straight and specific. And the reason we do this is because it's considered a structured interview style, which gives us, the individuals who are critiquing the interview, the ability to objectively match the candidate to and compare candidates for the same position while we're asking very specific job relevant questions. And we use the same predetermined rating scale when we evaluate all of our candidates. So it makes it very seamless, not only in asking the questions and kind of setting the expectation of how we want you to answer, but also in the scoring of how you answer those questions. So people always say, Kerry, how do I answer these questions? What is the best way? I'm racking my brain. So I tell you to take a breath and look back at all of your clinical experiences, peds, community health, med surg, perhaps your senior preceptorship, and think of a time that you really stood out. Maybe you performed memorably. Maybe you had an immediate connection with the patient. Maybe you had some out of the box thinking, and you really want to write down what happened. What was the environment? What was the setting? Was I at Stanford Health Care in the neurosurgery unit during my clinical rotation for med surg? What was the issue that came up? Did I have to prioritize care? Was it a patient who really wanted to speak with the family? There were no visitors. What was the event? What was the concern? What happened? And then based on that, what did I do to resolve this issue or to help this issue or to help this patient? Did I manage care? Did I prioritize? Did I escalate? What resources did I use? Who did I use? How did I communicate? So really take time to kind of go step by step and look at everything you did. And then don't forget the outcome. What happened at the end? Now, the outcome may be very direct to the patient if it's a clinical situation, but perhaps it's a communication situation with a provider or a time that you received constructive feedback. The outcome may be what I learned. How did I grow and how did I change? So don't just think about how did the patient do, but the situation may be about you in the role of a nurse, your professional growth and development, and then what was the outcome for you? Be open, be honest, tell us the full story. Don't forget the outcome. Don't say, I don't know what happened to that patient. I don't know what happened to that patient. And then stop. You can say the patient was transferred to the ICU. I was unable to follow their care. However, this is what I learned. There's an outcome, but you don't want to keep that audience hanging. Practice, practice, practice. The more you talk out loud, whether it's with a colleague or a family member or your mirror or you record yourself, the more comfortable you will be talking out loud to a group of strangers. It will decrease your anxiety and give you that kind of added confidence that will allow you to shine and be a little bit more relaxed. Try to keep your answers very clear and to the point, and that's why you want to practice. When we're under pressure and we're nervous, we start to ramble. Sometimes we forget what was the original question that they were asking, and now we're telling the story and we're not sure which direction we're going. But if I've had a moment to kind of practice, either with another individual or in front of a mirror, I'm more aware of how I communicate and when I'm going to start to ramble. We don't time you. Timing is an added stress that we don't want to put on you. However, if you continue to kind of have very long 5-minute answers, there will be some direction. For example, Letty, thank you for your answer. I'm just going to remind you, let's try to keep your answers to about 2 minutes. Just so you have some prompting. When you look at behavioral interviewing, you want to look at all of the aspects that clinical nurses are involved in. Now, this isn't all of them, but this is some of them. And what you can notice is you can really clump some of these together. So how I manage time is also how I delegate, which can be also how I communicate with other individuals and how I prioritize. So if you're given a prioritization question, you can use, I escalate, I delegate. This is how I manage my time. Right? If you're given a compassion and caring question, that can also be, this is how I advocated for a patient. This is how I provided really important real-time education to maybe a learner who couldn't read or spoke a different language or had no family support. They intertwine. So I don't recommend that you go and say, I need a communication answer, and now I need a time management issue, and now I need a delegation answer. That's too much. The idea is to say, how do my stories fit all of these categories? Because a lot of what we do intertwines. How I resolve conflict is also how I communicate. So think about what are the similarities in your stories. And then if you're asked a communication question, you'll be like, I have one. And it also hits delegation, and it also hits maybe education, and it also hits time management, or whatever that may be in that pattern. So you're coming to the interview with like 5 stories that you feel really comfortable with. And if you're given a question that maybe doesn't meet that, that's okay. You can pivot, but you at least have kind of 5 experiences that meet several of these big buckets. So how do you answer? The first thing I say to everyone is listen to the question. The question is usually multiple parts. Tell us about a time that you received constructive feedback. What was the feedback? How did you respond? And what have you learned? So that's a lot to take in. So if you just blanked out because it's your turn, then you say, do you mind repeating that question, Kerry or Letty or Pratham or whoever your facilitator is? Don't go into the question without knowing the question. It's perfectly acceptable to ask for that question to be repeated. You can also write it down. Perfectly acceptable. If you need some help kind of guiding your answers, you can use the STAR method. It tells you what was the situation. I'm going to tell you what the situation is. I'm going to tell you what the task I was given or what the action I had to take. And now I'm going to tell you the result, which is the outcome. It keeps you kind of moving in that direction. And then you want to showcase yourself as a registered nurse. So if the question is, tell me about a time during your clinical rotation, make sure it's about a time during your clinical rotation. You all have a wealth of volunteer experiences, a wealth of work history, personal experiences. Maybe this is a second career. That is amazing. And you may be given a question that says, tell me about a time that you received constructive feedback. And maybe it was feedback that you got from a coworker when you worked in engineering previously. Totally acceptable. But if the question is, tell me about a time during your clinical rotation, the ask is that you use that moment to showcase how you demonstrated that work in the role of a registered nurse, because that is the role that you are asking to be hired into. Okay, so really, how are you going to prepare? You're going to bring your best self, right? That's always the goal of an interview. I'm going to bring my best self. But how do I do that? You're going to say, I'm not going for an interview. I'm going to go have a conversation with some individuals who don't know a lot about me. I say, approach an interview, especially a virtual interview, as though you would a blind date. So you come, you don't know much about this person. You want to get some information, but you also you want to share information. If you approach the blind date as, hi, my name's Kerry. I work at Stanford. I've been here about 16 years. Right away, the person on the other side of the table is going to be like, I don't know. I don't have any energy. I don't know if I can connect with this person. What's up, right? But if you come and say, good morning, my name is Kerry. I'm a Bay Area native, really excited to be here. I went to the University of San Francisco for my undergrad. You're engaging that audience right away, right? So remember, it is a conversation. It's individuals who want to learn about you. You get to choose what you get to share with those individuals. So bring that to the table. Bring your personality, connect with your audience, nod your head, interact, show some emotion. You can smile. People who get really nervous, I often tell them to say, acknowledge the nervousness. Oh, sorry, I'm really nervous. It breaks the ice immediately and allows you to reset. That is absolutely okay. The one thing you need to remember is when you are hired into a residency program, especially as advanced beginner nurses, it is our responsibility to teach you the application of all of that educational content that you got during your nursing programs, right? I'm gonna hire you into Stanford. We're gonna show you the Stanford policies, the Stanford way. We're gonna give you a really robust orientation. We're gonna put you through this year-long residency program, all of this. What we cannot teach you is how to connect with patients. Human-to-human connection is one of the reasons that you came into this profession. You have that ability. It is rare and is unique. You need to show it, right? The ability to walk into a patient room and say, hi, my name is Christina. I'm going to be your nurse today, and connect with that patient is not something we can teach you. So if you are able to bring that to an interview, managers can see that. Wow, I really like how Christina introduced herself. I feel like she has good energy. She was nodding when other individuals were answering the question. She seems really engaged. I see her connecting with the audience. That is huge. Allow yourself to shine. Really hard for nurses. We don't like a lot of attention. We're usually very modest and humble. We don't want a lot of praise. This is not the time to not shine. So if there's something that you are really proud of, something that you have done, share that. Absolutely share that. If there is an event during a clinical rotation in which you really stepped up, or you were a leader, or you gave feedback to, an individual and that was really hard, share that. That speaks to who you are. Know and connect with your audience. So if you are interviewing at Stanford, the second week of May, it's for the adult patient population. So you want to have some of your answers. It doesn't have to be all of your answers, but you want some of your answers to reflect that adult patient population. So the managers can really say, oh, I can see how Kelsey would work in the adult population. If Kelsey only came and said, here are all my answers, and all of them are peds, sometimes it's difficult to see how Kelsey would transition into that adult patient population. Doesn't mean you can't use a variety, but I recommend not only talking about one rotation. Be genuine and authentic. Please, please do not read answers. Come, you're gonna be nervous. We know you're gonna be nervous. We try to make it as comfortable as possible. We give you the structure. We let people introduce themselves. But it's very obvious when people are reading because their eyes, like I am, don't look at the camera and they're talking seamlessly and beautiful, but they never connect. Immediately, you've lost that human-to-human connection. And as all of you know, from all of your rotations, nursing is not scripted. You come to work, here's your assignment, can't prepare for it, and you walk into that room. You just walk into that room. It's like you walk into the unknown. What's going to happen the minute I open the door? And so you kind of need to be able to pivot, and you need to be okay with that because that is what the job asks. So being able to do that in an interview is super important. It doesn't mean you're not prepared, right? If we were bringing you in an in-person environment, you wouldn't be able to read either. Just own the confidence and that I'm going to do the best that I can. And that's what your managers are going to look for. And then practice, practice, practice. That will build confidence, right? Going into something like the very first time doesn't feel great. Like, would I ever say to any of you, okay, have you ever put an IV in? You're like, no. Have you ever practiced IVs in the skills lab? You're like, no. I'm like, okay, well, you're going to put your first IV with no practice ever on this really complicated patient. You're not going to be successful. So give yourself the opportunity to talk a little bit and practice so you have that confidence when you come in. Here's a couple examples of some behavioral style interview questions. These are not necessarily the ones that we use. You can take a snippet or a screenshot of this. This entire webinar series will be up on YouTube following, so we'll be here for you to reference, but you can see it's really 3 parts, always asking about the situation and the action and the outcome. Okay, I've done a lot of talking. I want to turn it over to some of our panelists to share how they prepared and what they did to be successful. I chose this cohort, not Letty aside, but these 4 individuals because they all interviewed via Zoom. And so they have that reference because that is what our May panels will also be virtual. So if you have questions specifically about that. So I'm going to put Nathan on the spot because he has been on our webinars previously, and I'm going to allow him to start. But Nathan, if you could introduce yourself and then share what made you successful and how you prepared for your nurse residency interviews.
Good morning, everyone. Thanks, Kerry. My name is Nathan Torres. I'm currently in cohort number 32. So we're about 10 months into our nurse residency program here at Stanford. So I'm a clinical nurse too now in BMT, which is a blood and marrow transplant. So that falls under the umbrella of an oncology unit. Hi, sorry, looking at the chat too. So in regards to preparing for the whole interview process, I completely agree with Kerry. Like, all of these slides were completely amazing. But one thing that I found to be my biggest asset was my friends in the actual cohorts. So like, you know how we would have those debriefs after almost every shift at a clinical rotation. I'm not sure if you guys did that with your assigned groups, but I was lucky enough to have one particular friend that was through every single nursing rotation with me except for one. So we were both applying for Stanford. And what we would do was we would be like, okay, we went through every single clinical rotation, like every single one. And we tried to come up with 2 or 3 patient experiences from each rotation. And our goal of it was, because we would be like, oh, I remember that one time you told me about that one patient that blah, 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 blah. And so we would bounce off of each other, just different experiences through that. And then from those stories, those 2 to 3 per each, we would delve into it completely, like that one behavioral interview question slide that Kerry showed us. Like, everything is interwoven together. Like, you could have one experience of like, let's say like a postpartum hemorrhage during your maternity rotation. What did I do? Like, what was the outcome? How is this an example of like interpersonal communication skills? How is this an example of delegation? Like there's different components to every experience. And the goal for me and my friend was to actually like try to pick apart like different questions that could be asked. That way I can have one story for like 5 different questions. Because I found that a lot of my other friends who were interviewing were like, okay, we found this one question online. What's one story that could answer that one question? I always recommend flip it. Have one story answer like 5 or 6 questions from that. That way, when you're under stress, then if your mind just draws a blank, you have like 8 stories to draw from in the heat of the moment, and you can just go for it. And then when you do go for it, you're like ready to go. So that was like my biggest thing. Another component was Kerry did a great job of explaining that there are multiple components to answer a question fully. So my technique was, because we were on Zoom, my hands were free. So to make sure I answered each component and to keep me on track, I would touch each finger. So I had 4 fingers up. What did I do? Or what was the situation? Like, what did I do? What was the outcome for the patient? And then the fourth finger, always touch your fourth finger. Like, what was the outcome? What was the point? What did I learn from this? Like, what makes me shine as a nurse? Why do I want to be a Stanford nurse from this? What's the relevance of this? You could be doing CPR on a patient for 30 minutes. Then the managers are like, okay, what's the point? You're like, oh, this shows that I'm a good nurse because blah, 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 blah. Make sure you hit that point. Trying to figure out anything else, but yeah, just make sure you do your research on the program, like in regards to like what makes this particular nurse residency program shine for you. Why are you so driven to work with Stanford? They definitely want to hear that, to make sure that you're actually interested in the program. You're not just like blindly shooting forward, but yeah, definitely practice, practice, practice. What I would do too is like, I hate button up t-shirts or like button up things with ties. So my thing was, when I would practice, I would record myself so I could hear myself talk, number one. And number two, I would wear my tie because I feel really uncomfortable in fancy wear. So I would practice in it. That way, when it came time to actually perform, I wasn't choking on my clothes. That was just one factor that I could just like blow past me and stuff. So yeah.
Awesome. Thank you, Nathan. Edward, if you don't mind sharing how you prepared and what made you successful.
Sure. Hi, everyone. My name is Edward. I'm in the cohort after Nathan, so 33, and I'm in the oncology department. So like Nathan said, similar to BMT, and we are 7 months in, and it's been an incredible experience. I brought 7 things to talk to you guys about, and Nathan basically and Kerry covered exactly what I was going to say. So I just want to reiterate how important those points are, especially the idea of bringing stories and experiences that were really meaningful for you. I think it's super tempting, like Nathan said, to research all the millions of questions that could be asked and to place situations that you had accordingly. But I, like Nathan, brought in just 8 experiences throughout my nursing school clinical rotations that were really deep experiences where I learned a lot, did a lot. And I screenshotted Kerry's slide with the many Venn diagrams with all the core competencies of nurses, and thought of the ways that those apply to those situations. And I really tried to have my values as a nurse shine in those answers. So I know as students, it's really tempting to focus on the task-oriented things like placing in IVs or just, a Foley or whatnot. But I think for me, I was a teacher before this, I just really value more of the bigger picture things rather than the task-oriented things. And I know that those things will be learned in time on the floor. So I focused my answers more on my critical thinking, what was my assessment of the situations, and this like a bigger picture of what did I learn and take away. Like Nathan said, I used the STAR method, and I also added like a takeaway after the outcome result. Like, what did I take away from that? What would I do same or differently the next time if something similar happened? I would also recommend sifting through Stanford's website. There's so many resources, and really understanding what the nursing theory is behind Stanford, and seeing if that jives with your values, and talking about those and how you show those values in your behavioral questions. So that was really helpful. And there are so many resources that talk about unit-specific things that you could bring up to show that you looked into it, that you care, and that you want to be engaged and involved with what's going on in that unit that you're applying for. And then lastly, just the virtual thing really threw a wrench into the process. Eye contact is so important, and I found that as I was practicing virtual interviewing, talking into the camera like I am now is actually really awkward. But I'm much more comfortable doing it now because I would just keep talking and staring at the little circle to the left of the green light on your Mac. So just practicing things like that, because if you look at the screen, then you're not really making eye contact like right now. I'm not looking at you anymore. So things like that, or making sure your room is set up in a way where the lighting and the angles are just professional and appropriate. I think that's really helpful to do. And to just practice in a way that works for you. I think for me, I don't actually like to talk out loud and practice my answers over and over. For me, I practice when I run, and I just think through those stories, and I think of all the different ways I can climb up that mountain for that situation, and how I can pivot, like Kerry was saying, to answer the different questions. So for me, I don't like practicing out loud. It tends to sound rehearsed for me. So I just encourage you to practice in a way that works for you, and you're gonna find it.
Wonderful. Thank you, Edward. Bianca, can I shift to you to provide some insight?
Yeah, hi everyone. So I'm Bianca. I work on the neurology department. I feel like this whole webinar is wonderful. I didn't get the opportunity to see it before I got interviewed, but you guys have a great start already. Everything that Kerry said is definitely what is in the interview. For me, I'm not like really comfortable with public speaking and having a whole bunch of eyes on me. So kind of having this computerized webinar or like interviews were great for me. There's only like a couple things that I did that was different from like the other two. I'm in cohort 32. So I would use like little post-it notes and put it around the camera just as like little notes, not like full-blown sentences. I practiced a lot with my friends, my family. I even encouraged other like people that you meet online or people in your class to kind of, I don't know, work on your interview questions, because it does make a huge difference. I didn't use the STAR method. It didn't really work for me. I'm not sure why. I felt like there was always something throwing me off. So I actually use the PAR method, which just focuses on the problem, the action, and then the results, and then definitely utilizing the takeaway. So I added the T, and that's just what, you know, you learn from that situation. I actually found like, I think 12 to 14 scenarios, and I did a lot of research online to see the different kinds of nursing questions that they could ask. I also looked at Stanford's site to see what, you know, the hospital's goals were. Definitely focused on teamwork, because that's huge. And then when I would get stuck on certain questions, I would really focus back and put myself in those positions to where I experienced those situations. So if I was having like a patient, I think one of them was problem with a coworker or something like that, I would literally put myself back into that situation and think about what went wrong and what went right, and what could I have made like decision wise to improve the overall situation and improve the outcome. I definitely used my hands a lot more when I was doing the interviews, because I felt like when I keep them down below, I was just having like these little like touching, rubbing my hands, because I was getting really anxious and I would feed on that. So instead I would talk with my hands below the screen, so it wasn't so, you know, informal, just to keep myself moving and that anxious anxiety down. When I would slip, I don't want to say slip up, when I would pause, I would definitely just kind of take a quick breath, rethink about the question. Don't focus on who's looking at you or who's behind the camera. Just focus on your experience again, and then just jump back. What was the question? Okay, let's keep going, it's fine. And then remembering to try to stay calm. So breathe and then smile. Don't forget to smile, because I feel like if you smile, your personality starts to come out and it really shows like who you are, which is amazing. I'm trying to think of anything else that I did. I think the Post-its for me were key. But other than that, yeah, I feel like the information here is wonderful that you guys have.
Thank you, Bianca. Mia, last but definitely not least, some insight on how you prepared for your virtual interview.
Hi guys, my name is Mia. I'm from cohort 33. I don't know if you could all hear me. I've been having some audio issues on my computer. Perfect. So I'm in Edward's cohort, and pretty much everyone already covered what I was going to say, but I'll just go over some things that I felt like made me stand out a little bit more in the Zoom interview. So something that I did prior to the interview was think about some negative experiences I had during my preceptorship and what kind of work environment I wanted for myself. So anything that deviated from my negative experience. And so when I did my job search, I looked up all the different places that had good teamwork and a really good support system. And Stanford was definitely one of them. And they highlighted all the qualities I would want in a work environment. So everyone at Stanford, no matter what unit you go to, they're so supportive. If you look lost, someone will come up to you and be like, hey, is there anything I could do to help you? Are you okay? Are you gonna leave on time and clock out on time today? Is there anything I could help you do? Any meds I could help you pass? So this is something that I think spoke to me a lot, and it came through in my interview because I did talk about that negative experience in the preceptorship and how it helped me look for a good job environment and those characteristics that follow that. And then something else that I did was I meditated a lot because just like Bianca, I'm not a huge public speaking person. I get really, really nervous in front of large crowds of people and even on Zoom. So seeing 171 of you listening to me right now, I'm a little bit flustered. But I meditated a lot, so that helped calm my nerves. And part of meditation is being in the present moment. So what that means is you have to listen to what the other participants and candidates are talking about. So it's a panel interview with, I think, 3 other candidates, if I'm correct, Kerry. I don't know if it's 4 or 3, but that means you have to also listen to their answers. You can't just focus on yourself. You have to be present in the moment, listen to the questions carefully, and then also listen to the other participants' answers. Because I think what we tend to do when we're nervous and we're in an interview, you rehearse those answers in your head. And something I do a lot is before I order my meal at a restaurant, I would rehearse my order in my head before I say it. But I think what really came through in that interview was that I actually genuinely listened to everyone's answers. And when I had a similar situation happen, I would comment on it. I would be like, oh, I had a similar situation as Edward. But it was a little bit different in the sense that blah, 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 blah. And what I did differently was that. So I think that really shows that you were listening to other people and you're engaged and also you're present. And I think that says a lot about you as a person, and it could show up in the way you perform in a teamwork setting. So those are basically the only few things that I think Edward, Nathan, and Bianca didn't talk about, but everything else I agree with what everyone else said. So hopefully that helps a little bit in the interview for you.
Thanks, Mia. So thanks to the 4 of you. So again, it's just some perspective on different ways to approach how to prepare. I think a lot of times it's really daunting. I have an interview coming up. How do I prepare? We don't even know where to start. So brought these 4 individuals who have walked in your shoes and then have really demonstrated a commitment to their practice, not just in the residency program, but on their clinical units as well, to give you some insight on the different ways that they approached it. So if one thing works for you, great. And if something else doesn't, really work what feels natural for you. I'm going to pass the mic over to my colleague, Letty Cortez, to shed some light on that unit level interview. So you've made it through the panel. Okay, I made it through the panel. And now I'm going to go to that unit level interview, a little bit more intimate. There's no panel. It's you and the leadership team and whoever that leadership team selects to be part of that conversation. And really, what are those managers, clinical nurse specialists, educators, and staff looking during that unit level interview? So Letty, if you could, Letty and I are in the same room. That's why I keep looking over to her. If you could shed some light kind of on that process.
Okay, hi everybody, thanks Kerry. So like Kerry said, I'm a clinical nurse 4 here at Stanford. I'm an educator and I also precept. I work with Bianca. I wasn't able to sit in her interview, but I did get a lot of good feedback. My management team was so excited, like, oh, wait till you meet this girl. She's great. So her tips are whatever helps. I like that all 4 of our nurses came with really good feedback. I think they were all a lot of tips. I participated in a few panel and more of the unit level interviews, I think that something that's important to know is just, and it's been, I think, reiterated by all 4 of our nurses here, is to be yourself. Let your personality show. I think even our more reserved nurses, if that's your personality, let it show, but definitely just listen to what's being asked, and just answer your questions. And I like to just assure people that when you come into the unit level, you know, there's obviously something in that first interview that we saw or we heard. So just by bringing you into that level, maybe that will decrease a little bit of the anxiety. But we're all aware that there's nerves. So just again, like something that Kerry pointed out, if you are nervous, you can say, I'm nervous, I'm excited. Anything that's going to just show what's really going on is totally fine. I wouldn't ever tell anyone to like control that, or no, don't be embarrassed by it. If that's what you're feeling, it's definitely okay to acknowledge it. And then I think once that is out in the open, it may help you, or it may help the people in the panel interview be like, okay, she's really nervous, let's like, you know, try to make more comfortable, or they might format the interview a little different to facilitate that. Something that I have noticed, or that I like to give out to people, is we're not looking for perfection. Like when you're being interviewed, I don't usually go towards the questions that are, or the answers that are perfect, like what is that called? Cookie cutter. Sometimes, you know, some of our good responses, or some of the ones that stood out the most, was when somebody acknowledged a mistake, where they were like, you know, this is something that I wasn't happy with, or I made a mistake, but this is what I did and this is what I learned from it. And being open and honest about your experiences, or how you got to be, you know, form your practice, those sometimes stand out more than the actual, like, I did everything correct and I've never had a mistake. Because in real life and real nursing, you know, we're constantly adjusting and learning on the fly. So to have somebody be open and honest with that in an interview, you know, shows a lot. And we're also very familiar with the skill level, right? So we know that as a, you know, new grad nurse, you know, and especially dealing with COVID, so a lot of your clinical time has been affected. We're all open to that. So there's no, you know, just kind of like sharing what you've experienced and what you've learned from that, or how you made the best of it, is something that would really help you as well. And being open to growth. I think I really like to hear how people, even just so early in their career, have been trying to grow, or, you know, build upon things, or notice that they weren't able to get an experience here. So what did they do on their own? I think that shows a lot of commitment to their practice. And that's just my observation from being part of certain parts of the interview process. So yeah, I'm open to, I'll hand it back to Kerry. I'm gonna put myself on mute.
Thank you. And you guys will have the opportunity to ask all of these individuals lots of questions. We're just going to go through a couple more slides, and then we'll turn it over to our Q&A. The one thing I also recommend, totally agree with Mia, when you're listening to other individuals, answer their questions, but try not to compare yourself, right? Really hard to do. We do that a lot. We say the same thing to all of our nurse residents. Don't compare yourself to your colleagues. Because our experiences and how we grow and how we progress is very, very different. The other reason I'm going to tell you not to compare is because there will, without doubt, there always is a candidate will get a question and completely answer it, not what the question asked. And maybe their nerves, or maybe they heard it different, who knows? But what we have seen when that happens is every other person answers the same way that that first person answered. So it's okay if you're sitting there and you could be like, I don't think they answered the question. Listen to the question and don't compare yourself, right? Even if you hear these people who are like, oh, I had this ICU preceptorship and it was 288 hours and I coded 17 patients, and you're gonna be like, oh my God, I didn't have that. That is completely okay. All of our experiences are completely different. Our paths to where we got here are different, but you all got here. So you have something that we see in you. So take that with you as you come. You won't be coming to this panel interview unless we saw something that we wanted, or we wanted to hear more about. So try to engage, but not to let other people's words affect and impact how you are going to respond when the question is asked to you. So I'm not going to go through this slide. I'm just going to do a couple more slides because these are the frequently asked questions that Kevin and I get. These are all of our requirements to apply for the nurse residency program. They're on our website. They're always on the application whenever the application opens. They have not changed in quite some time. It says what are the first, it's really 4 requirements. And then under the 4th one is all of the documentation that we need from all of you. So any questions about that, you can reach out to Kevin and I, but this is really for applications, so I'm not going to go too detailed into this. So in terms of cohorts, we are hiring into our summer cohort. It will start June 28th. These are all of the areas that we are hiring into. So ICU, we're hiring into all of our ICUs. We're hiring into all of oncology, surgery, medicine, float pool, observation. And then for the first time, we're hiring into the emergency department, their observation area, also called the clinical decision unit. So growing our nurse residency program, not only into different areas, but by the number of candidates we hire, which is wonderful. So as you can see, tremendous growth. We are currently in fiscal year 2021, and we're looking to hire between 55 and 60 for our summer cohort. So that number is going to go way up. The pink numbers is our retention rate. So really happy that we all the way back to fiscal year 2017, especially being in the Bay Area where we know the cost of living is really difficult, to see that we have individuals who are staying 4 years into their career within our organization, because we see a lot of movement with new individuals and moving, but our nurses are staying not only on their units, but within the organization. So really proud of that, and looking to keep our 1-year retention rate above 90%. The national benchmark is about 83%, and we're holding tight at 99%. So really happy about that. So again, what is the goal of the nurse residency program? So you're hired at Stanford, you're going to start in that June 28th cohort, and you're like, I have no idea what I just signed up for, right? What is this nurse residency program? Do I get paid? Is it mandatory? What does it mean? Okay, so the very simple answer is when you interview and you are hired by the hiring manager and you work on the unit in which you were hired. So if you interview on E1 blood and marrow transplant, you are hired into that unit. It is a full-time job. You will have your shift. You work there, you will orient there, and you report to those managers. They are considered your boss, your leadership team. Then you participate in the nurse residency program. Your participation is mandatory, and it is a year-long participation. And so it is both education content in terms of application. So we are not going to reteach you everything that you've just learned in nursing school. Nobody needs to go to nursing school more than the amount of time that they went. So that's not our goal. Our goal is to say, okay, Danielle, okay, Angela, you learned about sepsis. How do you apply it at the bedside? What happens when you start seeing these signs? How are you going to communicate? What are you going to use to communicate? What are your resources? How are you going to move this patient forward in a positive way instead of having them kind of circle the drain, right? So it's very application-based, case studies, simulation, flipped classroom methods. So different ways of kind of trying to get these concepts embedded into you rather than like, what is sepsis or what is a pulmonary embolism? More like, how do I manage this at the bedside? And then kind of towards the second half of your residency program, more global concepts. How do I care for the dying patient? What does that look like? What does implicit bias look like? What is this? What are the social determinants of health? Why do I keep seeing the same patient or patient population come back? I'm working with chronic diseases and I constantly see that. What are the implications to managing and advocating for these individuals? What does cultural competency look like? And then how do I grow? So we bring you into this organization, into this profession. We know Stanford's a really big place. We want to help you with this in this transition, but then at 1 year, we don't say like, okay, thanks, and send you on your way. We want to say, you've made it through your first year. You really embedded that competency. And now where do you want to go? Now, that doesn't mean you need to go. We don't want you to go anywhere, but we want to say, what are the goals for yourself? What are the education goals for yourself? What are the professional development goals for yourself? And you may say like, I don't have any, I just want to like keep doing what I'm doing. I'm like, that's great. How can we support you to keep doing what you're doing? Or maybe you want to get certified, or maybe you eventually want to be a preceptor. Whatever that looks like, how can we support that continual professional development, not only so you stay excited about working at Stanford, but so we keep you within the nursing profession, because we need you. You are the next generation of clinicians, and so we need to bring you in and keep you passionate about the work that you do. So really our goal, you come in at that advanced beginner level, you are not novices, you have a wealth of information and clinical experience, set you apart, and our goal is to bridge you to competency. Competency and safety are two different things, and oftentimes people intertwine them the same. I'm just going to ask everyone if they don't mind muting. Thank you so much. But competency and safety are two very different things. So when you come off orientation, the goal is you're safe, right? You know who to ask for help, you know where your resources are. Competency is a developed skill. So we continue to work on your competency and really try to solidify that around the 1 year time frame. So the nurse residency program follows Vizient. What Vizient did years and years ago is they said, why are so many nurses leaving within the first year? We're seeing massive attrition. It was primarily when I started nursing. There was a nursing shortage, and nurses who were hired were not staying within the. So Vizient came along and they said, I want to talk to hospitals and I want to talk to schools of nursing and see where the gap is. And so they came together and they say, we need to have a program that supports this transition to practice, because it is not the easiest transition. You don't get to come to work, perhaps like somebody in business who gets to sit down and have multiple drafts and multiple different PowerPoints and do mock presentations. We're like, Danielle, your patient is coding. Let's go. And you got to go. And there's not always a lot of time for let me do trial and error, right? No patient's like, absolutely, trial and error. That sounds perfectly fine with me. No, the goal is we have to teach you in real time in an environment that we don't have a lot of control over. And so we want to add a level of education or a layer of education and support so you feel okay in that environment. And so our goal is in the nurse residency program is to focus on leadership, patient outcomes, and then your professional development, and then support you through that first year transition. Super busy slide, not going to go into detail, but if you said, what are the nuts and bolts of the nurse residency program? I would say you have clinical orientation on the unit in which you're hired. We've extended that clinical orientation due to COVID because we know there's a gap that most of our local schools of nursing had because they couldn't get into the clinical environment to complete their senior capstone. Not for all of you, but that is the sense that we're getting. So we've really increased our number. It's now for medicine, surgery, the ED, CDU, and oncology, this should say 30 shifts. And then for the ICU, this is 41 shifts. So you're seeing around 3 to 4 months of direct clinical orientation. We do check-ins. The check-ins are collaborative. Your unit education team, your leadership team, members of the nurse residency program, yourself come and meet multiple times a year, 3 times during your orientation, and then 3, 6, 9, and 12 months to really make sure that you're on pace. We give you the opportunity to do an evidence-based project. I know everybody's like, really? An evidence-based project? Yes, because everything you do needs to be rooted in the evidence. So the goal is not that you're doing this massive project. The goal is Kevin comes and says, I don't understand why we take out IVs after 72 hours at Stanford. Like the IV looked perfectly great. It wasn't red, it wasn't swollen, I got blood. Why am I taking it out? Because the policy says. And what we'll say to Kevin is, go see what the literature says and let's change our practice if it's saying we should be doing something different. We have seminars. We meet monthly within the nurse residency program. Right now it's all virtual. Hopefully we'll shift back to in-person. And then we give you the opportunity to do simulation. Very different than how you did it in your nursing schools. You're not graded, you're not evaluated. It's the opportunity for you to practice. So then when you get into the clinical environment, you're more confident managing those situations. Okay, a lot of information. I'm going to stop sharing my screen and I'm going to give you all the opportunity. I know we love the chat feature, but I'm going to give you the opportunity as though you were on your interview to come off mute, to turn your cameras on. And for those of you who don't have your cameras on and you don't like having your cameras on because it makes you super stressed, maybe this is a good time to put them on, come off mute, and ask any questions you have. It could be to me or Kevin or the panel. And we'll spend till about 11:30 doing a Q&A session. Okay, Sabrina, kick us off.
Hi, Kerry. Hi. Thank you so much to everyone on the panel for the really insightful tips. I just wanted to start off, but I had my one question is regarding the kind of the deadline for when we would need our license by. Is that a test date or do we need our license by the start time? I'm a little confused about that.
Kevin, do you want to answer that question?
Yes, testing, 1, 2, 3. Can everyone hear me? Okay, awesome. So basically it's a test date. So if you have your NCLEX scheduled by no later than May 28th, you're eligible to interview for our June cohort.
Thank you.
You're welcome.
Angela, question from you.
Hi, yeah, my question has to do with the letters of reference. Now, I just sent out my a request. I got one back from one of my clinical instructors, and it's on the school letterhead. Do I just include that with the application, or are you more like you want it blind and just send an email to the instructors and then they send it to you? What's the best way to do that?
No, you will submit your letter of recommendation as part of your portfolio. So gather all those documents from your clinical instructors, and then when you apply, you will have the opportunity to upload all of that.
Okay, now when you say a portfolio, does that mean we put our application, our resume, our statement letter, our letters of reference, etc., all as a PDF file in there, or is it all segregated as part of the profile on the website? How does that work exactly?
So Kevin can add some insight. We transitioned to Workday. And so for our June cohort, which we know was, you all had to get an email and then resubmit. Some individuals had one large PDF and it went like cover letter, resume, transcripts, here are my letters of recommendation, and others uploaded each separately.
Okay, so it can be
so it's really either. Kevin, I don't know if anything is changing in Workday that would impact that.
Current state, no. However, for the next program, that's the plan where you're able to just combine everything into one file for the next cohort. But we really don't have a preference. Current state, you could do it separately or all combined, Angela.
And one last question, I don't mean to dominate, but okay, I'm more interested in, I guess it's cohort 36, which starts August, September, or October. So when we go to the how do we know to apply? We just apply between June 21st and July 9th, but is it going to be nurse residency that we put in the search? How do we know how to do that?
You are correct. It'll be listed as a Stanford new grad residency. And you could just put that in the search item and then it'll pop up as the main requisition to apply to.
Okay, that sounds good. And you're going to say that you want us to have one PDF with everything. It'll be explained, correct?
Correct. Every single step will be explained. Like I said, we really don't have a preference. As long as we receive all the documents, that's
okay.
Pretty much the main point.
Okay, I appreciate you. Thank you very much.
Hey, Courtney, you have a question?
Yeah, I have a question. In our initial application, we had submitted stories about ourselves. Is it okay to use those same stories in our interview?
Yes.
Okay, I just want to make sure. Thank you so much.
Absolutely. Irvin.
Hey, Lee, just a couple questions for you. So I guess my first question is, you said that we're going to be interviewing up till I think the 13th or the 14th, right? If we do the second interview, following that second interview, do you know how much time it'll be before we know if we received it or not? The only reason I ask is because like I haven't offered for another organization. I want to be like as professional with them as possible to let them know, because like, you know, this is like Stanford would be my number one choice. So I would like want to be as professional with them as possible. So I just want to kind of gauge what we're looking at in timelines. But yeah, I don't know if you can give out that information or not.
Urban, I totally can. So I'll be making offers beginning Friday, May 14th up until Wednesday, the 19th. So anyone who was hired will hear from me within that specific time frame, and sometimes earlier, depending on how quickly I receive the feedback from the nurse managers.
Okay, thank you very much. Appreciate it.
Okay, Caitlin, question from you, excuse me.
Yeah, I just had a clarifying question and then another question after that, if that's okay. So the first question, can you just go over, so the 10th and the 11th, so you're doing 5 panel interviews per day with 4 people. So you're going to be interviewing 40 people over those 2 days?
Oh, no. We're interviewing 260 of you guys.
Okay.
You go big or go home, right? So if you are sitting for critical care is running on the 10th and the 11th, 20 people on the 10th, 20 people on the 11th. So is oncology. So is surgical division 1, surgical. So they all are interviewing. We're all interviewing at the same time. Okay. I think it's 7 panels we're running each day. The only department that is only running one day is the emergency department, is only on the 11th. Their volume of hire, as you can tell, is not going to be as big as all of surgery. So we don't need to bring in as many candidates. Okay. So we're looking at, that's why Kevin is probably calling you all very frantically, because I was like, Kevin, we're going to bring in 260. Here you go. Happy calling. So a large group. Yes.
Okay. Thank you. That makes a lot more sense. And then I was just curious, looking at the retention rates that you showed of that graphic, what changed between 2016 and now that really increased the retention rates for employees?
That's a really good question. I wasn't over this program at that time. So I don't have the specifics. We started hiring a lot more and into a lot more departments. We opened up into the critical care environment, which has always been a very attractive specialty, and previously we didn't. And really kind of giving individuals the opportunity to choose surgery versus medicine versus critical care versus oncology and now versus ED, rather than you're applying to the nurse residency program kind of as a lump, because we want to place you in an area that you feel passionate about. So that is an assumption. I've only been with this program for a year. I was in management before that. And I think also there's a lot more residency programs in our area. And I think that's important. I think people need to go to an organization that they feel connected to. And so we don't lose individuals to kind of like facilities anymore who just didn't have a residency program. I have colleagues at UCSF that I'm in contact with. They are expanding their residency program. El Camino is back on track running their residency program. The VA actually never stopped. They have a commitment to residency program. Kaiser is very invested. So people are really going to where they feel is a good fit. And I think that's important.
Thank you so much. I appreciate that.
Sure. Is it Parisa? Did I say that right?
It's Parisa. Thank
Parisa.
you. Yeah. Thank you, Kerry and Kevin, for hosting this. I also have a 2-part question, and I'll make it quick. I know you mentioned for the panel interview, at that time, there is not the space for the applicants to ask questions, but for the unit portion of the interview, if we do move forward, is there the space for us to also ask questions to the person interviewing us? And then the second question that I have is, say we have multiple units of interest, say 2, maybe 3 different units that we express interest in. Is it possible to have get accepted into the panel interview and from there get interviewed for 2 different units, or will the panel bring us down to just one option and move us forward?
So great questions. First one, yes. Bring all of your questions to the unit department. they will give you the opportunity to ask whatever questions you have. So yes, bring those. In terms of how do we select? So you choose your specialty, and then you sit in front of the specialty hiring managers, and those hiring managers will say, I think Parisa will be really great for my unit. I really like her teamwork. I think she'll work well with my team. I'm going to invite her to come to the ICU trauma unit interview, and you are only invited to one unit interview. We used to allow you to choose, and then managers were competing over the same individuals, and managers were trying to like sell their unit, and it just made it really challenging and put a lot of pressure on you guys. And so we take that off. If two managers are very interested in you, we will call you and give you the opportunity to choose where you would like to interview. And you will be called, they do all of kind of their final, the second day panel interviews, they look at all of the candidates that sat before them, and then they go through and see who would be a good fit. So it'd be Tuesday the 11th. So if you get a call from a 650 number on Tuesday 11th, please pick it up, and it will say, hi, ICU trauma and ICU neuro both really were interested in you. This was the hiring manager who sat on the panel for each of them. You will then say, Kerry, where should I go? I very neutrally have to say, I can't give you that information. You need to choose. And then I put you on the spot and tell you have to choose now, because they're going to offer you unit level interview. So that is the only time that you have the decision to kind of choose where you go.
Thank you.
Sure. Lauren, you're up.
Hello. I have a question. It's more related to like interviewing. That's come up for me a bit. The question of tell us like a time where you were able to demonstrate leadership. I was told that you should always draw from clinical experiences rather than any volunteer or past work experiences. Is that true?
So my recommendation for Stanford, I can only speak for ours, is if the question specifically says, tell us about a time during your clinical rotation. If it doesn't say that, then you can freely speak about any experience. That is our guide for our managers. But if it does say clinical rotation, my recommendation is to stick with that.
So I've always struggled with that a little bit, just because in the hospital setting, we were always like under a nurse, and do you have any examples, or is anyone of how to like navigate those questions when I don't feel like I've ever been able to exactly make executive decisions because I have to be working under my nurse and I'm learning. And I've been wondering how to kind of navigate those.
So any of our nurse residents on the panel want to help Lauren with this question?
I guess I can. So the way that I answered it was more so leadership like role and taking initiative. So let's say you had a patient who, I don't know, because I used to be a CNA for 5 years. You had a patient that fell off of, or you saw, someone fall off a commode during your clinical rotation. What did you do to immediately initiate care? Who did you involve? And then if you wanted to do extra work, you could look into like the hospital policies. Oh, maybe we weren't implementing it. Were all the call lights, like the lights on under the bed? Was there a call light within reach? Were they in pain? Why were they getting up? So for me, that's how I would have answered it, because you're taking the initiative to find out what went wrong and how you could have improved it and coordinated everything with your team in order to make sure that doesn't happen again.
Okay, thank you. That's very helpful.
Any other insight? Nathan, Edward, Mia?
I was going to say the same thing. Like, leadership has an expanded definition, and we tend to think of it as super grand, but just like Bianca, I was thinking of examples of when family members are there, how did you take initiative to take care of them? And like, telling your nurse you have ideas of how you can provide better care to the patient and the family, or things, things that you kind of just went above and beyond, that shows leadership, that shows that you're thinking proactively about how you can make the environment better. I'll take initiative to clean the room because it tends to just get really messy with all the items getting stockpiled there. Like, did you go through in the beginning and just open the blinds and clear out all the space? Because most likely maybe your nurse didn't do that, the nurse that you're with. So those are ways to show leadership as well.
Okay, yeah, I think I was thinking too big, but those are all the little things you can do too. So thank you very much.
And I think just kind of remember your scope and know that the hiring managers are aware of your scope, but embrace that stuff. Like that is, don't look at it as like, that's all I did. That's big stuff. Like we were all student nurses working under a preceptor where you're like, oh. And so to be able to go, one of the answers we got from someone with a similar question was a candidate who said, there was a patient coding in a room. I knew that was not my skill set to be in that room, even though it was interesting and would have loved to observe, but I saw that there were needs on the floor. There were call lights going off. There were visitors who were looking for help. So I took it upon myself to kind of manage the floor. And it was little things, but that shows like teamwork. That shows that you're able to read an environment. You don't need to be right there front and center. You put the needs of patients before you're learning. So it shows a lot about your character. So even though it may seem very simple or matter of fact, it speaks volumes to who you are. So take some time to look at those examples. Don't dismiss them right away. Kind of look at them a little bit more deeply because you'll see a lot of character traits in them that will allow you to shine.
Thank you.
Hi, Alexandra.
Hi, good morning, everybody. I just wanted to say thank you for the opportunity to just provide so much insightful information. It's helped ease our nerves. It's been a whirlwind of a journey. My question is, will you be changing the application questions from the previous cohort just so that we can kind of get a head start on like our application and answering those questions? Will you be changing them or keeping them the same? And then my next question is, how many slots are there for the ICU, and how, like, are you able to provide that information for how many slots are in each one?
So for your first question, that's a really great question. We did not change the questions between cohort 34 and 35. Will we change them between 35 and 36? It's really hard to say. It's not a sole decision on my end. And we have an advisory board. We look at all of our application screening. Our goal is to make it really seamless for the applicant and equitable for people to apply. And so we bring that to our advisory board. And then kind of based on our bandwidth, we also have to do a huge amount of training for everybody who reads, because we read every single one of your applications, like everything about it. So that's a great question. One of the goals between Kevin and I is if we do decide to update, I ask him on social media to kind of blast those questions. And then we always do a webinar, usually a week or two before the application opens. And we give you all the questions during the webinar as well. And then the application is usually open for 2 weeks. So you have time to work on them. Tentatively, we're looking for the summer cohort between 55 and 60. The critical care environment is taking 10. The emergency department is taking 2. I want to say oncology, we're looking around 8 to 10. Medicine and surgery are usually about 20 each. And the reason I say tentative is because I haven't heard from every single manager and kind of what their requisitions and whatnot. And then we have a lot of managers who say, I'm only going to take 2, and then they hire 3 or whatever that may be. So the number is fluid, but that's essentially what we're looking at right now. Kelsey, question from you? Oh, you're on mute.
Whoops, forgot. Thank you so much for this Zoom. It's just been so wonderful. And I also really appreciate your communication and support with everybody. It's been a tremendous experience to go through all this, nerves included. But my question was for the panel interviews, and then you get the unit interview. Are the unit interviews one-on-one then? And is there a time limit to those?
So the unit interview is usually about an hour.
Okay.
And in terms of one-on-one, yes, you are the one, but it could be.
Oh, it could be multiple people. Okay.
Yeah, so it might just be the manager. The manager may bring their assistant managers. They may bring their educator. Some of them bring staff in. We allow them to bring the individuals that they want to bring. And then it's behavioral style interview questions. And then there's a little bit more of kind of they're trying to get to know you a little bit better.
Okay.
But you won't have
and
any
then-
other nurse residents on that unit level interview.
Okay. Okay. And then one more question as far as kind of the resources available to the residents. Is like the simulation lab open kind of all the time, or is it specific to kind of the activities that you do together as a nurse resident?
So we don't actually have a simulation lab, but this is a recorded session and maybe that will get us a simulation lab. It's always what I've been asking for. So we share a classroom with life support, and all of our simulation equipment is in there. So no, it is not kind of a come and practice. We have very specific times. We do a little bit of skills. The issue we've had with skills, and the nurse residents on the call this, is the skill level is so high at Stanford. So what Edward has to do is very different than what Bianca does. And so trying to kind of meet Edward where he's at in oncology, and Bianca in neurology, and then with our ICU, and we would literally have you in the skills lab for months, because not only is the equipment very different, but what you're specialized to do is very, very different. And so it's usually broad skill stuff, crash cart, Zoll, peripheral IV, that sort of skill wise. And then the very complex stuff like epilepsy management, chemo, hazardous drugs, left ventricular assist device, chest tubes, pacemakers, ECMO, that is at the unit level, because there's no way we can meet all of those needs.
Okay. And then for the education sessions, does that include the entire nurse residency program, or are they more unit specific as well?
So your whole cohort comes to every seminar, and kind of how we break that up. Maybe we'll put oncology all with their oncology nursing professional development specialists, or we have you run situations together and kind of intermix. So it really depends, but you all have the same seminar schedule. So you all show up, and then kind of how we break you up is really dependent on the content.
Okay. And so there is some cohesion with the entire nurse residency
Oh yeah, so
program
that's part of the goal. The individuals on this call will be like, really? Because they've been on Zoom this entire year that they've been in the program. So that is really the goal. Stanford's a big place, right? You walk in, especially with everybody wearing a mask, connection is really important. One of the nurse sensitive indicators not nurse sensitive indicators, excuse me, one of the nurse satisfaction questions years ago was, do you have a friend at work? Really important that you feel part of a team and that you connect with the people you work with. You work 12 hours. It's a long day to be with people that you don't connect with. So the goal is that you have some connection both on the unit and within this program. And so the goal is really to bring you back. We do team building, we do pulse checks, harder on Zoom, as they will all attest, because people just aren't as comfortable, but that is the goal, to have you have individuals who are in your exact place, because no one else in the organization is exactly where you're at, except for those individuals in your cohort. So giving you the opportunity to have those relationships.
Thank you so much.
You're welcome. Okay, just a few more minutes left. Mariko, question?
Hi, yeah, so I've noticed with some of the new grad programs, they do have like priority placement based on like schools or places like medical facilities that you have worked at with different organizations. And I was just wondering, do you guys do that as well? Or do you like prioritize like residents of the Bay Area, anything like that?
No, we don't do any priority placement. The only thing that we will do is So we don't look at your school that you went to. We don't look at where you had your clinical rotation. We don't look at we actually don't even see your address when we screen you. If you put that you're interested in surgery, and that's where you put your placement, and then we see that you did your clinical rotation, let's say in ortho, we'll put you on the panel where ortho is representing, rather on the panel where the ortho managers aren't there. So we try to align kind of like, if you did your senior clinical preceptorship in like community health, then it's a free for all, or peds, because we're not hiring into that. But if you did trauma ICU, want you to sit in front of the trauma ICU team because you have that experience, and that's rich experience. So that's the only time we try to align is after you've already been deemed a candidate for the panel, is trying to place, like I'll said to Kevin, can you put these people in surgical division 1 because that's trauma and that's ortho, and these individuals had done their preceptorship in those areas. All right, Jasmine.
All right, hi. My question kind of builds on top of that one. During the interview, like if I'm interested in critical care nursing and that's where I'm doing my preceptorship, would it be fair when you ask about like experience in clinical rotation if I not only, but if I spoke about like the ICU environment for most of it, or do you kind of want someone more like well-rounded and for me to talk about like my telehealth experience because I am part of like the pandemic cohort?
So I think it depends on the questions, right? So if you're interviewing for, surgery, talking all ICU might be challenging for that management. But if you're interviewing for ICU and you have great answers and they're all from your ICU preceptorship, there's nothing wrong with that. If you have a great feedback answer for telehealth, or a time that you received constructive criticism and it was in telehealth, then share that. Looking more at not kind of the situation, but how you responded to that, right? So they're not going to go, oh, that answer is from telehealth. No. No, they're going to be like, oh, wow, look at what she did to manage that situation.
Okay, cool. Thank you.
All right, we'll do one more, Miriam. I know you were waiting a while.
Hi, thank you so much again for doing this panel and for giving us the opportunity to ask questions. I was just wondering, a lot of my questions got answered, thankfully, but I was just wondering if we do the panel interview and, maybe another interview, but we don't end up getting hired, are we able to apply to the next cohort?
Yes.
Okay.
And please do. There's an 18-month time frame from graduation to start of cohort. That is our only requirement. If you exceed the 18 months, then you're no longer eligible. But yes, please do.
Okay, great. Thank you.
All right, you guys, I know we have some other individuals who have their hands raised, but I just want to be mindful of the time. And I want to thank all of our panelists. I want to thank Nathan and Mia and Bianca and Edward and Letty and Kevin for being here. Again, you will be able to watch this on YouTube. Feel free to reach out with any questions, and best of luck to all of you in all of your professional endeavors. So great meeting all of you. Take care, and we'll see you soon.